Hello guys, Dr. Blackman here. We're going to go over this model of the respiratory system. This is the lower respiratory tract, okay? Again, follow along with your lab student handouts because that's what you're responsible for, okay? Let's start up here. There's the trachea, or the windpipe that's carrying air into your lungs, okay? So trachea. The heart, of course, is taken out here, right? It's in the mediastinum here between the two lungs, okay? So the heart would be here. There's the aorta, okay? There's the superior vena cava, bringing blood back to the heart, okay? Down here, that would be the inferior vena cava because it's inferior to this muscle here, which is the diaphragm that separates thoracic cavity from the abdominopelvic cavity, okay? So this is your right lung, this is your left lung, okay? So we need to know the individual lobes, okay? This would be the right upper lobe, or you can refer to that as the right superior lobe, okay? Some folks will say superior lobe of the right lung. There's a lot of ways to refer to that. To me, the easiest is right upper lobe, okay? That would make B here your right middle lobe, okay? Now some students will ask, well, do I need to say that it's the right middle lobe because there's only one middle lobe? And by convention, we do say that. So please call that the right middle lobe, okay? Then this lobe here would be the right lower lobe or right inferior lobe, okay? So that takes care of the right lung, okay? The left lung here, here's the left upper lobe, okay? Or again, you can say left superior lobe. And then here is going to be your left lower lobe, or you can say left inferior lobe, okay? Now, a lot of times students will get mixed up because of this structure here, right? That's actually not a structure. That's just where the lung comes off, okay? So don't let that confuse you, okay? The structures that divide the lobes is called fissure, F-I-S-S-U-R-E, a fissure. So you need to know the names of these fissures that separate the lobes of the lung. This would be the left oblique fissure, right? It's oblique, right? It's at an angle, diagonal, okay? That would make this fissure over here your right oblique fissure, okay? And because this one is like the horizon, right? That's the horizontal fissure, okay? And for this one, you can just say horizontal fissure, right? Because there's not a horizontal fissure over on the left side, there's just one. So I'll call that the horizontal fissure. It's a little bit redundant to say right horizontal fissure, okay? If we take this off, we can see the respiratory tract a little bit better, okay? So again, there's the trachea. It extends down here. You can see the branches. We went over the branches in a different model, but I just want to point those out really quickly. The first branch would be the primary bronchus, okay? Then the second branch would be the secondary bronchus. That's right there. And then the third branch would be the tertiary bronchus, okay? And all these little wispy structures out here that are blue and white, okay? Those are your bronchioles, okay? So bronchioles are like small bronchi, right? Bronchi is plural, bronchus is singular, okay? If you look here really closely, you can see little grooves and divots in the lung there, right? Those are the air sacs of the lungs where gas exchange occurs, right? Those are called alveoli, okay? You really can't see those very well here. We'll see that better on a different model, okay?